Welcome to Fit Fun Abs, your community podcast for health and well-being and all things wellness. Today we're joined by the chair of the Scottish Drugs Death Taskforce, Professor Catriona Matheson. Thank you very much for coming along.
My pleasure.
If you'd just like to introduce yourself and tell us a bit about yourself.
Sure, yeah. So I'm Catriona Matheson. I chair the Scottish Drug Death Taskforce. And a bit about my background. Well, I come from an academic background, but originally a practitioner. I was trained as a pharmacist, and then in public health, and that's how I got interested in this area. And I've done a lot of work at that kind of interface of service provision and how can we provide services that are effective and people are willing and want to engage with to help support people who have drug problems. So that's been the kind of work I've done for the last 25 plus years. Spending quite a lot of time at Aberdeen University. I've worked freelance and also now I work part-time as well at the University of Stirling.
Okay, thanks very much. So we're here today to talk a little bit about the Drugs Death Taskforce. Could you perhaps tell us why it was formed, when it was formed?
Sure, yeah. So the task force was formed in the middle of 2019 when drug death figures had a very sharp spike. They had been increasing for some years and many of us had noted that and were aware of that, but the rate of the increase in what was published in 2019, which was actually the data from 2018, was extremely alarming and forced the government really to take some action. So the minister at the time for public health formed a task force to look at this. And the idea was to bring together everybody around the table who had some influence or could do something about the challenges that we had and share that influence and experience and look at the evidence as well to see what evidence can we bring to this problem, how can we work together with all across the stakeholders and come with some recommendations and solutions and put those into action.
Thanks for telling us that, Catriona. So it was quite an undertaking to start with, and obviously I'm happy to be part of it myself. Could you perhaps, I know there's a lot that's been going on with the task force, but perhaps in your mind, could you mention some of the positive outcomes and some of the successes from the task force?
Sure. So the task force brought together, so I guess I'll maybe explain a wee bit more about who's around the table and how that helped to kind of influence what we looked at and how we worked. So round the table, initially in the first sort of phase, we had the police, we had people from the Crown and Prosecution Service, others involved in criminal justice service from a health and criminal justice perspective. Various health professional groups. There was people with lived experience, generally from a kind of more lived rather than living experience at that point. And so we worked on some solutions and we considered things really from the point of what can you do as an emergency response? So what can you do now quickly and put into action as quickly as possible? And some of the early initiatives under that emergency response related to stigma, which I think we might talk a wee bit more about in time, but also around naloxone. How can we make sure naloxone, which of course you know well, Sam, is that emergency medicine that reverses an overdose. How can we make sure we really maximize all the possible outlets and opportunities to get as much naloxone out there and into the community at risk as possible? So with that in mind, the police were around the table and police carriage of naloxone was something that we were discussed from at the first meeting and at the second meeting in quite some detail. The police were at that time a wee bit reticent, but we're certainly willing to consider it. And then, you know, that developed, and I think having everyone around the table in that way really made the difference. The police were willing to then look at that and consider a pilot study to have police trained to carry naloxone. What helped was that you could then get the intranasal form of naloxone, so it wasn't involving the injection. And so it was based around that nasal form. So I would consider that one of our early successes. And that has been rolled out. It's been trialled in 3 areas in Scotland. And there's been, the last I heard, there was over 20 administrations of naloxone, but every week there seems to be a few more from the 700 or so police officers who've now been trained and are carrying it. So we hope that that will be rolled out nationally, but waiting on the full evidence from the evaluation. One other thing to mention, Sam, sorry, I don't want to ramble on if you're, but one of the other big successes is from the ambulance service, who've been really amazing partners in the task force. And they, from the outset, came to us saying, you know, what can we do? We really do want to, we know we've got a role to play. We attend the emergencies, we give naloxone. And for example, in that year of 2019, they attended 5,000 across Scotland, 5,000 overdose cases. So through that and through that positive kind of partnership, we worked to have a system where we train all the ambulance staff to have naloxone to leave with the person when they attended an overdose. They'll leave the naloxone kit with ideally a family member or somebody who lives with somebody at risk. Train them up and explain about how to use it in case there's any future incidents. And from that, hopefully the ambulance service are also now looking at how we can link people into services from that kind of initial consultation or attendance at an emergency. And do you want me to tell you about one other one? Or
no, go on, please go on.
Yeah, I'll tell you about the one other kind of flagship sort of success, hopeful success story. Is the development of overdose response teams. So that's where somebody has an overdose, either from ambulance or accident emergency attendance. They can get outreach from a third sector or type service. Started in Glasgow with the Glasgow Overdose Response Team, but we've recommended this across that all areas should have some form of overdose response, where somebody gets, through outreach, gets a visit and try to hook them into some form of service or care and provide that kind of immediate wraparound care at the point where obviously people are often traumatized from having an overdose, and hopefully at a position where they might be willing and keen to reach out for support. So that's a kind of three things I've picked out from the emergency response part of the task force work.
No, that's absolutely incredible. I wasn't going to cut in. I was actually going to ask that, just how important you thought it was to have that intervention there. That you've answered that. Yeah,
yes, it is key. I think just at that point to make sure you can reach out to people and give them the opportunity there and then to hook in. Because if you miss that, then I think it's a missed opportunity, isn't it?
Absolutely. And can you tell us what the statistics are for the latest drugs deaths?
Yes, they went up slightly again. So the data, we've just had data published last month for 2020, which of course was the year of COVID, and that brought another kind of complicated layer of challenges for everybody. And so then we're up to 1,339 overdoses in 2020. So that was a slight increase on the previous year, I'm afraid. And it's just a sign of the challenges that, the scale of the challenge is really considerable, and it will take a bit of time for us to start to bring that down. But I do believe that we can do that. when we get on top of some of these additional challenges that COVID has brought.
Had the task force not been there, had all this work not been put in, although we see a rise in figures, surely they would have been a lot higher had these things not been done.
For sure they would have, because we do know that, for example, we know there's been 1,400 extra naloxone kits have been distributed through the kind of lifetime of the task force as part of that initiative. Now that's not to say all of those would have saved a life, but that's extra potential lives saved. So, and you know, we've seen over 500 people through the overdose response team, and that's just in one area. Actually, the other areas are now up and running with that too. So there is no doubt that things would have been worse.
Absolutely, it's incredible. And you mentioned it before, and we'll mention it now, stigma. Could you briefly just mention why it's important, why it could possibly hold back progress and reform and such like?
Yeah, stigma is one of these things that comes up all the time. It's just such an important issue for us to really get to grips with. Came up at our first task force meeting. And any of the research work, for example, where you're speaking to people about, you know, the challenges they have, stigma always comes up. So the reason it comes up is because people feel stigmatized. They don't want to seek help. They don't maybe want to go to even to their GP or to some kind of secondary care for accident emergency, for example, if they have a health problem, not necessarily anything to do with their drug or alcohol use, but they don't want to because they feel they'll be seen as a drug user first and foremost, not a person that needs care and support. So that prevents people from seeking the help and support that they would need for general health problems, for mental health problems, but also for their addiction related issues as well. And we need to get over that. We need to get beyond this because that's contributing considerably to, you know, people having poorer health, which impacts on, you know, how their body can handle drugs. You know, if they've got respiratory conditions or heart conditions or something with circulation, any of these things will make you more susceptible to an overdose. So we need to get past that. But also people need to feel that they have some worth and they're regarded as, you know, as people that we want to support, and to get that message to people, because otherwise people feel fairly hopeless. And if you feel hopeless, you know, you don't value your own worth and your own life as much, and you're more susceptible to taking chances and to overdose. So for all of those reasons, we need to work hard across society really to address stigma and understand why people do use drugs. I mean, some people, you know, the reasons behind it are complex, and there you know, there's lots of different reasons. It's not all coming from a place of you know, people making wrong decisions. It's often coming from a place of coping with other things, coping with family issues, coping with difficult childhoods or traumas, or coping with, even as people who start using drugs get into a position where they themselves witness traumatic events, and then you get into a pattern of using drugs as a coping mechanism. There's so many complications to it. It's not about any, we need to take any consideration of personal moral feelings out of this. And that's what people feel that they are being judged for, and just see somebody as a person who needs support and help. And that's why we need to, that's what we need to do. And the task force came up with a stigma strategy to help that process, and the government is taking that on now, which is really welcome. And we're encouraging individuals and organisations and professional groups to have a stigma charter where they actually basically say, you know, we will treat people with respect and dignity and provide support and think carefully about things like language and images used, because all of that does make a difference in terms of how you represent people in the public kind of domain.
Absolutely. I think education is it's always the key. And some things myself I'm guilty of and learned from your course recently. Is that self-stigmatizing and talking about myself in a certain way, which may then be stigmatizing to others, but it's also putting myself down.
Yeah.
And it was a wake-up call for me, and that's 4 years on, you know.
Oh, good. I'm glad that you found that of interest, because there's no doubt that having that self-stigmatizing kind of image as well just affects how people then, how you view yourself and how you then behave. But also, also that's important for service providers who you want to kind of engage with, whoever they are, from whatever realm we're talking about, has to understand that you might be coming from a self-stigmatizing kind of place, and that might affect how you present yourself and how you so it's a kind of complicated thing, and that's all wrapped up in what some people describe as trauma-informed care, which is a term that's used quite a lot, but it is important because it's just about understanding if someone's experienced trauma, that will affect them and affect how they interact with other people, and we need to recognize that and work with that, and not judge that and make it an extra barrier, but in fact it needs to be an extra way of kind of engaging with people.
And of course, we've got International Overdose Awareness Day coming up. Well, how do you feel that helps with things such as stigma, and what's the importance of the Awareness Day?
Yeah, it is a time for raising the awareness, isn't it, within the wider community, the wider population, if we can. And just having that discussion, really, like we're having now, having that discussion about how people are perceived, what can be done, how can we actually present things differently. So that's one aspect of it, certainly around helping to kind of address this stigmatizing aspect. The other thing for me, of course, is just helping to actually raise the awareness also of overdose, of the kind of signs and symptoms of overdose, and what to do if you come across an overdose, and how to how to manage it in terms of phoning ambulance and first aid and naloxone and all those things. So Overdose Awareness Day has those really two strong components. It's an important opportunity to engage with the public as broadly as we can, and to make sure we do the right thing if we ever come across an overdose situation.
And hopefully we'll be speaking to Alcohol and Drugs Action as well. But for people in Aberdeen in general, what would you say to them or advise them to do if it was either of the things, whether someone's going through the use of a substance, or if faced with someone that's about to have an overdose? Where could they reach out to?
Yeah, I suppose so. If you come across, if somebody sort of reveals to you anything, or you about having a drug, a problem with drugs or alcohol or both, it's just taking that time to not judge, and just, so it's a simple thing. It's maybe ask a little bit or learn a little bit, or if because people will generally respond to that. I don't know how you feel if people would, but if they don't, it's because they want to, want to be private and keep things to themselves. But it's just taking the time to stop and think a little bit about what might be behind the behavior of drug or alcohol dependence. In terms of then the other, what do you do if you suspect you're coming across somebody is overdosing? This is something to look out for out and about, but also in parties or venues or pubs and clubs, etc., because it can happen anywhere. Look out for those symptoms of people. Obviously, somebody would be collapsed, pale skin, maybe lips starting to go blue. It's about phoning an ambulance as quickly as possible, seeing if there's anybody who's got CPR training, could start doing some CPR, and the ambulance will also help. The ambulance service will also help talk you through that. See if there's naloxone. if anybody's around that has naloxone, I mean, I would really urge anyone to look into where they can get naloxone and people to carry it around with them, especially if people who are out and about a lot in the city centre or in communities where we know there is, you know, a reasonably high level of problem drug use. Find out, get naloxone, carry it, find out where you can get it. And a lot of community pharmacies in Aberdeen will now give a supply, giving it out. And maybe we can add a link, Sam, to some of where those pharmacies are, so that I know the Alcohol and Drug Partnership have got a list of the pharmacies who will supply naloxone, and just with a bit of minimal training on how to use it. So that's what I would say. Phone the ambulance, see if there's naloxone around, and start CPR, and the ambulance service will help you talk you through it. But the other thing to be aware of is for people who use these street benzodiazepines as well as opiates, which are an increasing problem. And cocaine use in Aberdeen is very high, and we need to be alert and aware of that, because that might be more likely to cause an overdose that has effects on the heart, you know, heart attack effectively, as well as sort of affect stopping breathing. So it's about being alert to that, and if you're phoning an ambulance, look out for any kind of signs, or ask people if there's any information that might indicate that they have taken any substances, and that will help the response.
Thanks so much, Catriona. I think that's something, obviously, as you know, we noticed with Fresh when we were training our first lot of volunteers. We had an overdose at Marks and Spencer's, and that was 2 people through, it was benzos. It wasn't opiates, but they were in a bad way. And it was amazing how many people were just walking past. So
yeah,
perhaps that's something, even if someone doesn't want to get involved, they could make a phone call, you know, and even just that is a good start, rather than just
absolutely,
walking past.
Yeah, I mean, never assume. I mean, I know it's tragic, isn't it? Just the thought, if you see someone collapsed or slumped over, that people will walk past. But if you come across it, and I dread coming across this myself, but you know what to do. Go and try and rouse the person, see if there's any response, get in the ambulance, phone 999 right away, and then do some of those other things. If there's anyone around that will do CPR, if there's a defibrillator, a lot of public places have defibrillators now. And of course, so it's about shouting for help. With, you know, if you're in a public place, it's about shouting for help, and there will be people around if it's a busy public place that will have be able to have, you know, will have the skills to help respond with CPR, defibrillation, get the defibrillator, and the naloxone.
Absolutely. And go on.
One just a little extra there. I know that benzos, people say, oh, they took benzos. There's not. I would always administer naloxone, even if you think it is just benzos, because you just never quite know what is in them, or what somebody may have taken previously. So just always use naloxone. It doesn't do any harm. Naloxone will not do any harm to anybody.
I think that's the key thing to remember, isn't it? We can't harm anyone. Firstly, for the Drugs Death Taskforce, are there any things in action, or what's coming up for the task force?
Well, the big thing coming up is next week we are publishing a report on drug law reform. So this is another aspect of work, not under that emergency theme that I've kind of talked more about today, under the work about reducing risk for people. And so there's been a considerable consultation and look at evidence and around drug law reform. That report will be published next week on the 6th of September. And I think people will find that really interesting. There's been a lot of discussion, and the media love to talk about, you know, changes to the law and things like drug consumption sites and these kind of issues. We will cover some of that, but we cover all of that, in fact, in this report. So there's things that can be done there about, you know, do we need to change the law in some instances, or what can we do with the existing law? How can we make the existing law work better for people so that they are not overly criminalised too soon, and in fact will, you know, diverting people to a more health-based approach rather than criminal justice. So there's, and how can we maybe just change that ethos around how we care for people who, in the criminal justice system. So that's the next big thing. So look out for that.
I know it sounds exciting, and yeah, great job, brilliant news. And for yourself, lastly, Catriona, what's on the cards for you? What's coming up?
Well, tomorrow well, on Overdose Awareness Day, I'm going to visit. I'm being allowed out of Aberdeen. I haven't been able to make the kind of visits and things that we would have been doing in an ideal world. So I'm going to Glasgow to visit the team who are providing the overdose response team there, who started that bit of work, to hear from them. So I'm really looking forward to actually being able to get out and about. A bit nervous about having to use public transport and travel, but we have to get back into that now, don't we, Sam? So yeah, that's the very short-term thing that we're working on.
Yeah, we have to get back to normality, or the new normal, whatever we want to call it. Well, thank you so much.